Dr. Andrew Huberman and Dr. Peter Attia discuss the concept of vitality and longevity in the Huberman Lab podcast. He explains that longevity can be divided into two parts: lifespan and healthspan. He says healthspan can be measured along three dimensions: physical, cognitive, and emotional. Dr. Attia emphasizes the importance of addressing all three dimensions of healthspan in order to increase longevity and maintain vitality. The major exit points for people along the lifespan route include death from chronic diseases such as heart disease, cancer, and neurodegenerative diseases. Dr. Attia then discusses the death bar analysis, which involves looking at actuarial data to determine the leading causes of death. Atherosclerotic cardiovascular disease is the most consequential cause of death in terms of numbers, responsible for 18 to 19 million deaths per year globally. Dr. Attia discusses the importance of accurately measuring blood pressure and recommends manual measurement with a stethoscope on the brachial artery. He suggests people can check their own blood pressure manually with a good stethoscope and cuff. Dr. Attia recommends starting with an automated cuff and recording 2 readings a day for 2 weeks to get an accurate average. He is also investigating whether a watch or wristband can accurately measure blood pressure. He also emphasizes the importance of monitoring cardiovascular health and managing high cholesterol levels. He notes that while statins are effective, they can have side effects such as muscle pain, liver damage, and insulin resistance. Dr. Attia discusses PCSK9 inhibitors, which are injectable drugs that block the protein responsible for degrading LDL receptors in the liver. He recommends monitoring apolipoprotein B levels, a key marker of cardiovascular health, starting in one's 20s or 30s, especially with a family history of cardiovascular disease. Dr. Attia also emphasizes the importance of blood pressure control through exercise, nutrition, and weight management, rather than immediately turning to pharmacotherapy, which can have side effects. Various aspects related to cancer and its prevention are discussed. He emphasizes the importance of balancing longevity and quality of life and highlights the complexity of cancer and the role of genes and lifestyle factors in its development. Dr. Attia explains that obesity is not the direct cause of cancer, but rather a proxy for 2 underlying factors: insulin resistance and inflammation. He suggests that waist-to-height ratio is a better metric for determining obesity than BMI. Dr. Attia emphasizes the importance of exercise, sleep, and correcting overnourishment. He also stresses the significance of kidney function, which is often overlooked in modern medicine, and the relationship between alcohol consumption and health. Dr. Attia advises that if one can avoid drinking altogether, that is the best option. Dr. Attia discusses cancer screening methods, including visualization, imaging, and liquid biopsies, and emphasizes the importance of early detection and using a combination of screening modalities. He advises listeners to be mindful of radiation exposure from medical imaging and to ask about radiation levels before undergoing any imaging study. Dr. Attia also mentions the benefits of MRI scans, which do not involve radiation. He recommends minimizing exposure to known carcinogens and acknowledges the difficulty in calculating cancer risk from everyday carcinogens. Dr. Attia and Andrew Huberman discuss genetic screening and its usefulness for certain genes, such as APO for neurodegenerative diseases. They emphasize the importance of cancer screening, particularly for colon cancer, which is 100% preventable through colonoscopy screening. Dr. Attia recommends screening for colon cancer no later than age 40 and stresses the importance of being thorough in family history and screening practices. Dr. Attia discusses the specificity problem with aggressive cancer screening, where stacking more modalities can lead to finding things that aren't cancer. Whole body MRI is used for cancer screening, but patients are informed of a 25% chance of finding something that requires further investigation. The genetics of Alzheimer's disease are also discussed, with the E4 genes of the apolipoprotein E gene being highly associated with the risk of Alzheimer's disease. However, they are not deterministic, and there are at least 3 deterministic genes in Alzheimer's disease. People with Alzheimer's disease usually die from failure to thrive, aspiration, or infections due to their body's vulnerability. The role of amyloid beta in Alzheimer's disease is controversial, and Dr. Attia suggests that the overemphasis on amyloid beta may have been due to the index case of Alzheimer's disease. In addition to these conversations, Andrew Huberman and Dr. Peter Attia discuss various topics related to brain health and safety. They begin by discussing head injuries and their prevalence in sports, car accidents, bike accidents, and construction sites. Dr. Attia suggests that the best way to prevent head injuries is to avoid engaging in activities that lead to them. He also mentions hyperbaric oxygen therapy as a potential treatment for traumatic brain injuries, but cautions that there is a lot of poor quality research on its benefits. The conversation then shifts to accidental deaths, with automotive accidents, falls, and overdoses being the 3 main causes. fentanyl-related deaths have become a significant problem, with the drug being woven into many different substances, including counterfeit and illicit drugs. Dr. Attia warns parents to be vigilant about the danger of illicit counterfeit pills, which are often laced with fentanyl and can be deadly even in small doses. Finally, they discuss the importance of maintaining muscle strength, particularly fast-twitch muscle fibers, to offset the risk of falls and fractures in the aging population. They also note that there are some unequivocally true things for brain health, such as the importance of sleep, lower LDL cholesterol and APOB, not having type 2 diabetes, and a combination of low-intensity cardio, strength training, and interval training for exercise. Dr. Peter Attia discusses the 4 pillars of longevity through physical exercise, which include strength, stability, aerobic efficiency, and aerobic peak output. He emphasizes the importance of eccentric strength and stability, which are crucial for preventing falls and maintaining quality of life as we age. Dr. Attia also stresses the importance of emotional health, which he defines as having healthy relationships and attachments to others, a sense of purpose, the ability to regulate emotions, and experiencing fulfillment and satisfaction. He shares his personal struggle with being present, and emphasizes the importance of taking control of our own lives and improving the quality of our relationships for a better overall quality of life. Dr. Attia also discusses the importance of repairing damage in relationships and prioritizing the relationship over being right or achieving a specific outcome. He suggests focusing on repairing damage when it occurs and understanding oneself before approaching a difficult relationship. Dr. Peter Attia talks about various aspects of health in the Huberman Lab podcast. He emphasizes the importance of continuous blood pressure monitoring and avoiding smoking and vaping, which can cause harm to the body and brain tissue. He suggests other delivery devices for nicotine and cannabis, such as tinctures, patches, gums, and edibles. Additionally, Dr. Attia explains the chemistry of cholesterol and how the body transports it through the circulatory system using lipoproteins. He dispels myths surrounding cholesterol and emphasizes the importance of understanding it. Dr. Attia notes that ApoB lipoproteins are atherogenic and contribute to atherosclerosis, while ApoA lipoproteins can perform all the functions that ApoB lipoproteins do. He also discusses the importance of cholesterol in brain development and the difference between LDL and ApoB. Finally, he argues that current medical practices are backwards because they focus on calculating an individual's 10-year risk of major adverse cardiac events rather than addressing the underlying cause of atherosclerosis. Check out the full podcast by clicking the link in the description below. Make sure to like, comment, and subscribe for more content like this. Thank you for listening to this podcast summary episode of the Pod Slice.